So, Andy, can you turn your head towards the left? Okay. So, we're going to be looking for the pulsations over by the neck area. Okay. I think you'll see it better here. Okay. Okay. Look at this pulsation here.
Yeah.
Okay. And the pulsation goes, so it comes in waves of threes.
Oh, wow.
Right? Look at the pulsation over there.
One.
It goes one, flick, 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 flick. It's a single pulsation, unlike this one. You see it? Okay, so this is the jugular venous pulsation, and that one over there is the carotid pulse. Give some space to Suki. Okay, so this, you need to identify the jugular vein and differentiate it from the carotid artery pulsation. Okay, so after we have identified the jugular vein, like I said, if you were not so sure, especially in obese patients wherein the pulsations will not be as prominent, you can actually raise the head of the bed, and as you raise the head of the bed to 45 degrees, the jugular pulsation, it slowly becomes smaller. By the time the patient sits at a 90-degree angle, sitting upright, you will not see it anymore, unless, of course, we said there is heart failure. Okay, so it is strong, because especially since it's slim. Okay, so that one there will be your carotid artery pulsation. Now we take the measurement for the venous pulse. So like we said, the main landmark will be the sternal angle. His is very prominent. Feel it. So from here to the ridge.
Yep.
So that's the angle of Louis, or what we call the sternal angle. Okay, and that will be our landmark where we will put this ruler. Okay, put it this way. This is like a rough estimate of the central venous pressure. And we observe for the point where you have the highest point of pulsation. It's going to be somewhere here. Okay. Now, oops, my tongue blade is not, sorry. It's not long enough to reach. So, I will just need to like make an estimate. Okay. See it? A 90-degree angle. Are you seeing it? Okay. So that's about 1 inch. And 1 inch is how many centimeters?
12.
Huh? Inch.
Oh.
Not a foot. 1.
10.
Huh?
10.
No.
What, 2?
2.54 centimeters. So 2.54 centimeters plus, what's the standard? 5 centimeters. So we said that the 5 centimeters is the distance between the right atrium and the sternal angle. So that would be
7.5.
7.5. And our normal is
9.
9 or less. Okay, 9 centimeters or less. So is his normal?
Yeah.
Okay, so his jugular venous pulse is normal. Okay, I wish we can. Oh, now it's working. Earlier it didn't want to work. Huh.
Guess I'm too heavy.
Not you, maybe the other student earlier was too heavy. Because I tried to. How come this one doesn't work anymore? It used to. Okay, so I just want to show them. So if, for example, we put the patient's head, turn your head to the left or right so that they can see. Hold still. Look at it. It's smaller
Yeah.
compared to earlier. You can see it all the way up here. Now, when we put up the head of the bed, you no longer see it. What you're seeing is the carotid artery pulsation.
No more.
You don't see the jugular vein pulsation. Can you
It's
appreciate the
two,
difference? Huh?
2.
What two?
It's not in 3s. You can't see
You
it
don't see
anymore.
the jugular vein. If you come closer, you'll just see it
Oh,
flicking
see it.
once. Those are single pulsations. Okay, so that is for the jugular vein. Now, the next part will be assessment of or to identify the landmarks. Do you have a shirt underneath? You want to take off your uniform so that they can better appreciate? Okay. So, if you look at now the different landmarks, so we said, ladies, his sternal angle is very prominent. Feel yours. From the sternal, what do you call this area? This depression here.
This one here?
Yeah, that one there. What do you call it?
Mid clavicular line.
No. Okay, so that's a sternal notch.
Sternal notch.
Not even close.
The name gives it
Okay,
away.
so from the sternal notch, palpate your own, what you call the sternum. You will feel a ridge. Put down your pen, you'll stab yourself. Okay, you'll feel the ridge. Are you feeling it? Okay, so that is the sternal angle. Do you feel it? Felt it? Yeah, this one here.
Okay.
Okay. Here, this one here.
I think it's
Feel it?
clavicle.
Not the clavicle.
This one?
Here, this part here. So
A for effort.
your fingers. You see, you feel that ridge. Okay, in the midline, not anywhere else, not in the clavicle. Here.
I keep forgetting these two fingers. Okay. Yeah.
Okay, so that's the sternum.
This one?
This way. Yes.
Yeah.
Okay, so that's the sternal angle, or we call it the angle of Louis. Okay, so that's an important landmark because if you move your fingers a little to the right or to the left, that will now identify the second rib. Okay, bring your fingers, so his, it's very prominent, so second rib. Bring it down, will be the second intercostal space. Okay, then you have the third rib, third intercostal space, fourth rib, fourth ICS. Okay, so that's why his is very prominent. Okay, so we identified the sternal angle or the angle of Louis. You have the second rib, you have the second ICS, and then we have left mid clavicular line. So clavicle, midline, like I said, this will be along the nipple line. Okay, unless your nipples are over on this side. Okay,
No, I had to look to make sure it's the same.
a little more. Mid.
Here.
Okay, yes. So along this side. Okay, that's the mid. Left.
Checking both sides.
No, left. Go the left. To the left.
To measure
Okay.
it and go here.
Okay. So it's going to be along the nipple line. That's the left mid clavicular line. Left MCL. And then you have the left anterior axillary line. That would be here.
Here.
Anterior axillary line. The side of the breasts. Okay. And then you have the mid axillary line.
Is it here?
Here, yes. Here, by the, starting from the axilla. So again, second, the second rib. First, hold on. The angle of Louis, second rib, second ICS, left mid clavicular, left anterior axillary, left mid axillary, AAL, anterior axillary, MAL, mid axillary. Okay. So once you have identified the landmarks, we are now ready to identify the cardiac areas. So we have the aortic area. Aortic area, we said, is along the second ICS, right sternal border. So it's going to be here. So we look at it. Okay. And then we have the pulmonic area, second ICS, left sternal border. Okay. And then we go, so this will be the third rib. Third ICS, left sternal border is Erb's point.
So third.
Okay. Fourth rib, you have here your fourth ICS. Fifth rib, fifth ICS. Here. Okay. That will be your tricuspid. Okay, your tricuspid. Fifth ICS, left sternal border. And then you have your mitral, fifth ICS, left mid clavicular line. Remember, our ribs do not go straight like this. There's a slope, a less than a 90-degree angle. Okay, so those are your areas. Now, when we look at those areas, you are not, normally you will not be able to appreciate any pulsations. The only area where you will see a pulsation will be here. You wanna get your shirt a little?
Yeah, that's fine.
Heart failure. I don't see it.
Where is it?
You can see it here.
Have heart failure? What?
You don't expect the heart to be bounding.
I see it.
Feel it.
I don't have my gloves on.
It's fine, I don't care.
Sorry, my hand's cold.
Yeah, your hands are really cold.
Very cold.
Okay.
It's
I
like
hurt
ice
my
cold.
hands.
Oh my god!
It's like ice cold.
Do you feel it?
What's these cold hands? Oh my god.
You feel it there. Okay.
Enjoy.
Yeah, I can see it from here. A little higher. Okay. Okay. So that those are the cardiac areas. So initially, you will need to first identify, look for any pulsations. And like I said, the only area where you will see a pulsation is by the fifth ICS, left mid-clavicular line. Okay. After which, you now will palpate. Palpate the aortic. What is the area?
Second.
Okay.
Second what?
I see S,
Right
right
side.
sternal
Right
border.
side.
Okay. And then,
Second.
what is this?
Pulmonic.
Pulmonic.
Second ICS left.
Left
Sternal
sternal
border.
border.
You have to complete it. Okay. And then,
Third.
Third I see
I mean,
S,
herbs.
left sternal
Herbs point.
border.
Erb's point.
Third ICS sternal border.
Which one?
Right. Left.
Left.
Oh, left sternal border.
Sorry.
Okay. Focus. Focus. Okay. And then you have,
Tricuspid, fifth ICS, left sternal border.
okay. And then you have,
Mitral,
uh-huh.
fifth ICS, left sternal border. Mid
Clavicular line.
Okay. So you have then, so the only area where you will feel a pulsation will be here.
In the mid.
So when you see, when you're looking, you only will see the pulsation here. When you're feeling, you're only going to feel it here. And the pulsation by the fifth ICS left mid-clavicular line will be dime size. It's not going to extend all the way there. It's going to be a small area. And that's the normal finding. Now, if, for example, our patient is so obese that, you lifted already the breasts, you cannot palpate it, ask your patient to turn to the left. That will bring the heart closer to the chest wall so that you will be able to appreciate the pulsation. Okay, so we're done with the cardiac areas, right? Okay, next, we move on to the
This is one.
The S1, S2, S3.
Okay, so we have the heart sound. So we need to auscultate. And we said S1 is a result of,
Closure of what is it? Or
Aorta.
huh?
Semi-lumen. No.
No, S1, is that the contraction of the aorta?
Contraction,
Closure.
closure of
Aortic.
mitral and tricuspid. Okay, so S1 is a result of the closure of the AV valves, mitral and tricuspid, or tricuspid to the right, mitral to the left. Okay. So that makes the lub sound. Okay. So, where do we hear it louder?
Dub.
Aorta.
Why would you hear it louder in the aorta?
At the fifth ICS left.
Okay. Because it's the closure of the AV valves. You will hear it louder over by the fifth ICS, left sternal border and left mid-clavicular line, where you palpate, inspect for the tricuspid and mitral areas. So in this area, the S1 and as against S2, you'll hear lub, lub, dub. Okay. So S1 will be louder in these areas. Okay. Now S2 is the closure or is a result of the closure of the
Semilunar.
semilunar valves. Okay, and the semilunar valves are? Okay, so you have the aortic and the pulmonic valves. And so the S2 or the dub sound is heard louder over by the
The second ICS left sternal border.
okay, so you have the second ICS right and left sternal borders where you inspect and palpate